Bismillahirrahmanirrahim. Today we discuss a very important aspect of physiology, that one of the higher mental functions, that is memory. Memory is the ability, it is the ability to store or retain experiences, ability to store or retain experiences and to call these consciously or unconsciously. So ability to store or retain experiences and to recall these consciously or unconsciously. This is the memory. So depending upon the duration, memory is of three types: short-term memory, intermediate long-term memory, and then long-term memory. So these are the types of memory depending upon the duration: short-term, intermediate long-term, and then long-term memory. Brain receives a lot of information. Brain receives a lot of information. All these informations are not useful, not with consequences, not with consequences. So all of these are not retained. All of these are not stored in the brain. Many of these are ignored. Many of these are ignored. So informations which are ignored, not useful for the human being, is rejected, ignored. And that is called negative memory. So information which are ignored, not stored, is the negative memory. And this involves inhibition of synaptic pathways, and a process called habituation, Habituation results into inhibition of synaptic pathways and then negative memory. So those information which are useful, which have got consequences, these are stored or retained. And this is the positive memory. So information stored or retained, these are called positive memory. So positive memory is due to facilitation of synaptic pathways. Facilitation of synaptic pathways results into positive memory. And this process is called sensitization. Sensitization is the process by which positive memories are stored, retained in the brain. Now coming to the short-term memory. Short-term memory is the memory which remains for seconds to a few minutes. Remains for seconds to a few minutes. Seconds to a few minutes. With this memory, typical example is that a person consults the telephone directory, looks upon the telephone number, Keep in mind, this number is dial the number, and then memory finishes. So consulting a telephone directory to do the number, the telephone number is kept in the memory, in the thought circuit. Number is dialed, and then memory finishes. This is the short-term memory. So generally, telephone number of up to 10 digits are kept in the short-term memory. Short-term memory depends upon continuous neuronal activity. It depends upon continuous neuronal activity. As long as impulses travel along a thought circuit, memory remains. And impulses travel through reverberating circuits. So in the short-term memory, impulses travel continuously along the reverberating circuits. In the short-term memory mechanism, there is involvement of the presynaptic facilitation or presynaptic inhibition. So involvement of presynaptic facilitation and presynaptic inhibition. This is the mechanism of the short-term memory, which remains for seconds to a few minutes. What is working memory? Working memory is the short-term memory. Working memory is the short-term memory which is for a specific aim, which is for intellectual reasoning, or it is basis of some planning. It is the basis of some planning. I told you the example of consultation of telephone directory. The number is dialed. That is, of course, a working memory. The memory is based on the purpose to know the number of telephone and to dial it. Similarly, anybody has got some discussion, and for discussion, he or she needs some specific memory of some specific topic. That is kept in mind for say up to minutes and discussed with the others in the meeting. So this is the short-term memory, and then about the working memory, which is for intellectual reasoning of a specific aim. Then the other type is the intermediate long-term memory. Intermediate long-term memory. The memory which remains for days to weeks. Days to weeks is the intermediate long-term memory. This memory is difficult to recall and easy to be forgotten. Difficult to recall and easy to be forgotten. So a student prepares for a test. It is retained for say days or maybe a few weeks, and then it vanishes. It vanishes. Intermediate long-term memory depends upon temporary physical and chemical changes at synapses. It depends upon temporary physical and chemical changes at synapses. say increased number of synaptic vesicles, increased number of release of synaptic vesicles. So these changes occur temporarily to have the long-term memory. Then we come to the long-term memory. Long-term memory is so fixed memory. It lasts for years, or for the whole life. It lasts for years and for the whole life. Say, alphabets, basic knowledge about the religion, names of the relatives. So these last for years or for the whole life. Short-term memory is converted into long-term memory by consolidation. So by consolidation, short-term memory is converted into long-term memory. Long-term memory. Consolidation depends upon rehearsal or repetition. Consolidation depends upon rehearsal or repetition. You repeat or you rehearse some information repeatedly, the memory is consolidated and memory becomes long-term. Minimum consolidation occurs in 5 to 10 minutes. Minimum consolidation occurs in 5 to 10 minutes, and maximal occurs in 1 hour or more. So maximal consolidation occurs in 1 hour or more. You know, of the Quran, rehearse, repeat some verses many, many times. And this is consolidation. Now, what happened during consolidation? In long-term memory, there are permanent structural changes. So changes occur at synapses which are permanent. Say, increase in the number of presynaptic terminals, increase in the number of presynaptic terminals, increase in the number of synaptic vesicles, increase in the number of synaptic vesicles, increase release sites, increase release sites for the vesicles, and then changes in the dendrites or postsynaptic membrane to facilitate synaptic transmission. So changes in the dendrites or postsynaptic membrane to facilitate synaptic transmission. So by these changes in the thought circuit, synapses become permanently facilitated. So because of these changes at synapses, in the thought circuit, synapses becomes permanently facilitated. And when synapses in the thought circuit becomes permanently facilitated, it is called memory trace or memory engram. So memory trace or memory engram. Memory trace or memory engram is formed when synapses in the thought circuit becomes permanently facilitated. Now, in the long-term memory, we discussed there are permanent changes, structural changes at synapses. So these changes require protein synthesis, RNA synthesis. So in the long-term memory, there is RNA synthesis and protein synthesis. These are in the long-term memory, RNA synthesis and protein synthesis. Now in the experiments in animals, it has been seen that if we inhibit RNA synthesis, long-term memory does not occur. So long-term memory doesn't occur if we inhibit the RNA synthesis. So it means long-term memory will not occur if we inhibit the RNA synthesis. Now we have mentioned that memory engram or memory trace is formed when all the synapses in a thought circuit are facilitated permanently. Now in the nervous system, a large number of neurons are present. In the nervous system, in the brain. And when these neurons are used, these live. If these are not used, these neurons will degenerate. So if neurons are not used, these will degenerate. If these are used, then they live. So the basic principle in the brain is use it or lose it. Use it or lose it. If you use your neurons in the brain, the neurons will remain active, remain alive. If you don't use the neurons, you lose it. So neurons which are not used, which are not activated, will degenerate. So this was about the long-term memory, which remains for years or for the whole life. And it requires protein synthesis, RNA synthesis. We can also divide memory into two types. Explicit memory explicit or declarative memory. Explicit or declarative memory or explicit memory. And the second type is implicit memory or procedural memory or skill memory. So implicit memory or procedural memory or skill memory. Explicit memory is of two types: episodic and semantic. So episodic and semantic. Semantic, right? So explicit memory or declarative memory is of two types, episodic and semantic. Episodic memory is memory of some event, some incidents. Memory of some event or some incidents. Say maybe some accident. So the person able to retain the time of the incidents, location of the incidents, details of the incidents. This is the episodic memory. And then the second type is semantic memory. Semantic memory is the memory of words, language, and rules, or ULES. So memory of words, language, and rules. This is the semantic memory. Now keep in mind, explicit memory requires consciousness or awareness. So for this, say episodic memory, semantic memory, the person should be conscious, should be aware. So this memory requires awareness or consciousness. The second type is implicit memory or procedural memory or skill memory. So memory of some procedure, some skill. Memory of some procedure or some skill or some habit. So this is the implicit memory. So when there is development of implicit memory, we need consciousness awareness. Now once this memory is developed, some skill is developed, then you don't need awareness or consciousness. So when there is development of implicit memory or skill memory or procedural memory, we need awareness or consciousness. But when it has been developed, then you don't need consciousness or awareness. For example, a person learns to ride a bicycle. When he is learning, he will need consciousness awareness. Now once he has learned to ride a bicycle, he will not need consciousness awareness. He will ride the bicycle without without awareness. A person learns to play tennis, table tennis, lawn tennis, table tennis. When he's learning, there will be consciousness, awareness is required. And once he's learned to play, then he may not need the awareness. So these are two types of the memory, declarative memory and procedural memory, or the implicit memory or the skill memory. You need in the declarative memory, the parts of the brain required are hippocampus, other parts of the limbic system, and then association areas in the cortex. For procedural memory, you need the role of basal ganglia, cerebellum, sensory motor cortex. So in the procedural memory, skill memory, we need the basal ganglia, basal nuclei, cerebellum, and sensory motor cortex. Amnesia. Amnesia is loss of memory. Amnesia is of two types: anterograde amnesia, and then retrograde amnesia. Anterograde amnesia is loss of recent memory. So loss of recent memory is anterograde amnesia. Person is not able to retain the name and faces of the individuals with whom he has met. The person is not able to retain the names and faces of the individuals to whom he has met. The person not able to learn new skills, learn to retain new memories. This is the anterograde amnesia, and the cause is lesion in the hippocampus. Lesion in the hippocampus, it results into anterograde amnesia. So lesion in the hippocampus, it results into anterograde amnesia. Retrograde amnesia is loss of the remote memory, past memory. Loss of the remote memory or past memory. New memory can be retained. Recent memory or new memory can be retained. But past memory, remote memories cannot be recalled. These are lost. Some lesion in the thalamus, results into retrograde amnesia. Some lesion in the thalamus, it results into retrograde amnesia. There are certain drugs which promote or facilitate memory. Certain drugs promote or facilitate memory. These include caffeine, nicotine, physostigmine, amphetamine, strychnine, metrazole, nicotine, caffeine, physostigmine, amphetamine, strychnine, metrazole. These facilitate the memory by facilitating the process of consolidation. Now we discuss about a very important condition called Alzheimer's disease. Alzheimer's disease. Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease. It's a neurodegenerative disease. A neurodegenerative disease. There is a premature aging of the brain. It starts in middle age and rapidly progresses. In these patients, the mental capabilities are those of very old people. The mental capabilities becomes of very old people. First, there is effect on the short-term memory, and then other memories are lost. There are problems in cognition. The patient is not able to recognize his or her near relatives. There may be disturbance of the motor and sensory system, right? And these patients need constant care by the relatives. When these patients, beta amyloid peptides are deposited in the nervous system, different part of the nervous system has got plaques of the beta amyloid peptides. So in the cerebral cortex, thalamus, basal ganglia, cerebellum, hippocampus, deposition of the amyloid peptides. Now, in this disease, it is actually metabolic disorder. Metabolic disorder. In this disorder, the defective gene which controls the synthesis of apolipoprotein E2. So the defective synthesis of the protein apolipoprotein E2. And this protein is involved in the transport of cholesterol to tissues. Right? So this protein is involved in the transport of cholesterol to the tissues. There are certain risk factors to develop the Alzheimer's disease, say cardiovascular diseases, atherosclerosis, hyperlipidemia, hypertension. Right? So these results into the Alzheimer's disease. So thank you very much.